So we are coming actually to the final part of this workshop. There will be a panel discussion that will be hosted by Dr. Rao. Dr. Rao, I hand it over to you. Thank you.
Thank you. I think it was a great session. Two of them, particularly vaccines and access to technology innovations. I was just watching from the day one that we have crossed speeches, interventions, PPTs, and of 52 speakers in these 2 days with 6 hours. I think what we have done is we have reviewed and many of the issues, but yet there are gaps. And this session is basically to take account of what are the lessons learned from these 50 plus speakers. What are the insights into these talks? And then what are the key actions that people are suggesting? When I went back, I just started in the morning that we had a declaration in 2019. We in our 8 months of discussion to have this workshop, we have been always thinking, have we moved a bit from this declaration? One of them is to establish the business case. Are we establishing a good business case for One Health? One happy news I had this yesterday and today morning is that at least now OIE has come out with a consensus One Health definition. I think there is, after all, a consensus definition for starting our research in a more towards that direction. But yet, have you accurately assessed human-animal environmental health risk? Particularly, we still are not very sure about the biosurveillance. We are still not phase away, as Dr. Sachin said about yesterday, to make a case in terms of economic impact. At the same time, we have heard many voices about technical capabilities, both in terms of better predict, prepare, and respond to global diseases, threats, both even the local, regional outbreaks, epidemics, and also as well as the global ones. And the deficiencies could be laboratory capabilities, human resource, sustainability of laboratories. I think many people have assigned. Projects come and go, equipments remain there, whether we go further or not. That's one of the major questions globally. I think it should not be project-based. It should be program-based, and it should be sustainable for a long period, because One Health is not one-day affair. It is a long-term affair, probably once beyond one's lifetime. We also had some 10 recommendations earlier in 2019, One Health roadmap we had. I even flashed it in the chat box in the morning. Have you have a clear account of disease burden now? We have a lot of documentation on AMR, but overall disease burden, still the data is lacking. We discussed lots local, the way we would priority setting. I think Suresh session, Kuchipudi session, yesterday talked about a lot of priority setting, CDC list. Today also we talked about the last speaker telling what are the priorities based on so many responses in the Twitter or whatever. And there are priority areas of concerns of emerging infections, biosecurity challenges. Still the policy environment around these aspects has to be more nurtured. Now have you built the capacity for basic and applied research? Thanks to ILRI that it has been promoting a lot of these research areas in and around ILRI in the Africa region. And then capacity building for improvement, and then having internal capacities to train to trainers. And these are also one of the issues. It's a long-term goal. Diagnosis, vaccines still seem to be away, and the affordability, and then also issues like access to technologies we have discussed in detail in this forum. Sharing information. I think this one has been being effectively done. We have done through APAR and many other organizations. We have enough information in the internet sources to have the information about these particular things. And then we have to explore the partnership, and partnerships are being talked about, but they have to be sustainable. They have to be financially supported. And finally, the governance and policy mechanisms and regulations. I think the task force is addressing certain of these things. So I think we are evolving from that point of view. So I think what is this is that we have today learned many other gaps. I think I'll stop there. We have some eminent speakers who have been also leading some of the panels in this case. And I would like to hear with them, what are the other issues? Have we grown from our list, which I just narrated, and the concerns remaining, and what actions we take? In the morning, Jim actually was telling that yesterday, that we should not just have recommendations, we should have actions. And APAR also believes repeatedly that actions on the ground, whether it is actions in terms of programs, projects, or in terms of even capacity building, is very important. I'll stop there and I'll ask to start with Dr. Dieter. Sir, you have been all through our preparations. What is the lesson learned now, and how do we go about? Dr. Dieter.
Okay, thank you, Dr. Rao. Yeah, I'm very relieved because, when we went through this preparation and had some really major setbacks and overcoming this, and now seeing that we had really 2 days of excellent meeting. So I enjoyed the presentations, and we all know that One Health and biosecurity are very broad topics. There's quite some things which we didn't cover really, and should better cover this the next time. I think, as usual with One Health initiatives, it's very much focused on, for us from the International Livestock Research Institute, very much the lens of livestock is put there, but it's now going into the environment, nutrition, gender, and all these issues which we have on the program this time. And I really like this. I think we missed a little bit more on, or we should have had more on human health, from the human health side and wildlife. And I was very happy, that we had finally with the final session that we had quite some impact on wildlife. I think that's a very important part, and it's coming really up in the One Health initiatives and activities. And even we in ILRI are looking much more now at wildlife, and not just only on domestic animals, to see what is the transmission from wildlife to the domestic animals, and from there to human beings. I think that's something important. The other thing which was very obvious for me is that we all talk about the data, in particular Sue's presentation at the end shows how important data are and what we can do with data, and that we need a much broader database as we have today, and as it was yesterday and today already a topic, sharing data and using the data, all of the data we have by everybody, and then the data get another quality, another impact on the actions which we want to do. I think, and I believe, with the discussion we had today, that we are in a good way, and we have some ideas how we can really set up a database which is accessible for everybody, and then they're very helpful for what needs to be done. I think that's another fantastic thing. We all talk all the time about collaboration and cooperation and interdisciplinary activities. And I think it was mentioned in the chats, and we had it also in the discussion. We need much better to operationalize this cooperation and collaboration. And I think this type of conferences, as we had it yesterday and today, are really a way forward in really working together and get it down and make action out of this. I think that's the very important part. And I think we need to have a good network based on what we had as a network for these 2 days to go in the future in the next steps and working together. And I think there are quite a number of people we had not worked with before. And I think that's also an important outcome of this meeting. I think all of the participants found new partners and should contact them and integrate them in their own work. So that's my major takeaways from this 2 days. Over to you, Ro.
Thanks. I think great message. In fact, one of the messages you gave is on data management. I think I'll come to Dr. Karim later. I'll go to Dr. Tim, but he had a very few minutes in the vaccine session. He just flashed about the vaccine information network that they have in the International Vaccine Network. Can you just tell me about, beside this data on vaccines, Dr. Tim, are you there? Besides
yeah, hello.
Vaccine database, I think what other databases we have access to, and secondly, how the vaccine industry is flourishing in because we have not touched upon this. We always felt, because in the last conference also, a lot of these LMICs complained, even to access a vaccine strain, it is a big task. And there are questions about biosecurity to go for bioprocessing and production. So can you also highlight what are the difficulties that one is facing in terms of these countermeasures for these type of epidemics and pandemics, based on your experience on the network?
So,
Or any other issue to add also, of course.
okay. So the database is something that has been discussed for a long time, and we're just in the initial phases of developing it. I think one of the challenges for something like a database to be actually of value is to make sure that it's sustainable and it's going to be maintained. So it's a challenge we've had. There's been attempts previously to have such databases. So GalVmed had a database, and unfortunately, due to lack of funding, it fell out of use effectively. And as soon as that happens, it rapidly deteriorates. So that's a challenge we're facing. We've just initiated it. And one of the first things we looked at was vaccine producers in Africa. So we have compiled the preliminary data on that. And what we're looking for is how to structure the database to make it as useful as possible so it can be interrogated from a number of different perspectives. So in terms of the challenges, there is always the problem of the biomanufacturing processes involved. Some of them are very unique to different vaccines. So we've had a really good presentation in our first meeting from a new vaccine startup in Uganda called BrenTech. And it was very interesting talking or hearing that talk about the challenges they had. And they did include actually almost having to establish the regulatory framework for vaccine production in Uganda because it had never been done before. So I think there are lots of challenges there. There are new players in the field, such as BrenTech. Hester, someone mentioned, has recently started in Tanzania. But at least there is some infrastructure there, such as the PAMVAC, in terms of a continental-wide quality control system. I know there's new investments going into Nigeria for vaccine production there. So there is lots of new developments. As ever, there remains challenges, but I think the optimistic thing is that there are systems involved to deal with some of those, and the entrepreneurs that setting up the new companies often have the drive and the ability to overcome some of those challenges. I'm not sure whether Vish would also want to comment on any of this. As I say, I'm based in the UK, so I'm slightly apart from the situation, but there does seem to be cause for optimism there.
Many of the investors, hello, thank you, Dr. Tim. If Vish is around, I would just like to pass by asking you, there are many people who want to invest on vaccine production in Africa, but there seems to be a lot of course, I will put in inverted commas, political intervention. Vish.
You touch on.
That's why I put it in commas. Yeah.
Right. You touch on an interesting point. Just to continue what Tim was saying earlier, there are quite a large number of at least veterinary vaccine production centers in Africa. These tend to be leftover, if you want to call it that, institutions from government institutions that have either been privatized or go down to maintaining vaccine production. And for a number of these vaccines, if you think about them in the veterinary market, at least, these are fairly old generation vaccines. So they're either killed vaccines or they are live attenuated vaccines that were developed probably 20, 30 years ago, but are still widely used. And so there are a fairly large number of those types of vaccine production centers, institutions in Africa. The thing is that they need to improve and offer novel types of capacities for vaccine production. One of the big problems in Africa, unfortunately, is that there is a very small biotechnology centers. There's very small number of biotech companies, if you want to call it that. South Africa tends to be, and North Africa, I should say, kind of tend to be slight leaders in those areas. Other countries are beginning to try to catch up in that space, but on a continent where you have not much modern biotechnology going on, the knock-on effect of that is, unfortunately, there isn't really a large market in terms of personnel. And what we see happening, unfortunately, is there's a huge brain drain, right? A lot of those people in Africa who were involved in those basically leave the continent, and some of them come back, but not very many. The other problem, I wouldn't say problem, the other thing about vaccines, it's very often in African countries, they are viewed as being central to the government policies. They are controlled by the government. They're regulated by the government, and very often different countries have different policies. So West African policies, for example, are quite different to East African policies in terms of who can vaccinate, where vaccines can be purchased from. And so that creates other types of issues as well. So having a harmonization of that within Africa, Africa is over 50 different countries, is not a trivial problem. The other issue that I heard about, and we didn't get a chance to discuss, is this issue about access, free data, free flow of information, free flow of reagents, and the ability to be able to actually pass on stuff between countries. Unfortunately, that is becoming more and more problematical. It's becoming more difficult because of access to genetic resources. This is not just in the context of plants and animals, but also is unfortunately hitting the microbial sphere as well. So that's a challenge that I think needs to be addressed. Thank you.
Thank you, Dr. Vish. I think that was a good information about vaccines and the possibilities and challenges. I think there are two sets of issues. One is about setting disease priorities, and also there were a lot of issues raised on priorities, and also in terms of the what you call the related issues like biosafety, biosecurity, and issues around climate change and sustainability. We have two important speakers, Dr. Suresh Kuchipudi, in his session, very intensively it was debated on priorities, and Professor Vanda from University of Pretoria, who actually is having a lot of background expert in, I think, when he interfered on viral genosis from the medical point of view. I will also ask Dr. Vanda that there is always a concern between the interface between medical medicine, veterinary medicine and human medicine people. I think that you may touch upon later because we are going to have another workshop, but I'll ask you this question also. First, I'll go to Suresh and ask you, what are your experiences, lessons learned from this? Are we still way away from priorities? Are we still away from all the technologies? We have a lot to do, or we are achieved by defining it very well now by OIE. Suresh?
Thank you, Professor Rao. So this has been a very enriching learning experience, as we all have seen over the past 2 days. There has been a very rich and deep conversations around several questions. But as Professor Rao asked, one of the questions that I would like to touch upon is, how do we improve early detection of pathogens in Africa? And panelists have shared very profound thoughts on various challenges and limitations and current problems. And one of the key aspect we asked the panelists to comment on is, do we really have a reliable prevalence data for pathogens in the African context? In the absence of reliable prevalence data, so how are we prioritizing what zoonoses we are going to surveil for? So, and a lot of times it appears that the preference of pathogens that are currently focused is because they're very popular, or there is a previous record of these pathogens being prevalent in a certain part of the country or certain regions. So, and some of the key challenges that we heard from panelists, if I can summarize, also reflected in other aspects, not just diagnostics, are a lack of investments or capital, and also limited access to technology. And it was brought up by several panelists about the laboratory infrastructure. And also, as we heard earlier today, lack of trained personnel, whether it is laboratory or field veterinary personnel that could deal with wildlife animals, for example. And inadequate infrastructure has also come up repeatedly as one of the major challenge. And I was just intrigued by the comments earlier about the investments in, as we're talking in the vaccine context. Even in the diagnostic setting, one of the critical limitations perhaps is the relatively small markets, and clearly there is unstable demand. So it naturally begs the question: so who is going to pay for investments in the region so diagnostic capabilities can be enhanced? And we also heard that to establish technologies like the PCR or next generation sequencing and to sustain them, it's not going to be easy. It is fairly expensive. And one thing that I really wanted to highlight is the challenge is how do we foster the cross-disciplinary collaborative partnerships from a One Health perspective. And we heard all the different challenges, whether it is cooperation or data sharing, data management, and so on. And as Professor Rao clearly highlighted, how do we move forward with solutions or recommendations and not talk about challenges? And when I reflect on this, there are ways in which we may be able to address this. For example, one opportunity is to invest in infrastructure, but keep in mind with a plan for sustainability. So Dr. Dopp yesterday from OIE has clearly highlighted the fact that the one-off investments would not really be beneficial without a plan for sustainability. And an example work towards this is if we can think about building partnerships to initiate what would be the lighthouse projects on, say, a low-hanging fruit. And this will allow, or at least help different entities from animal health agencies, human health, and the environmental folks to work together. So these examples will provide an experience of how a multi-sector One Health project would look like in the African context. And clearly, Vivek and other colleagues have highlighted yesterday that this is not going to be a one-off development, whether we design surveillance projects or programs. This will be an iterative process. But the idea is that once we set up these lighthouse projects that will facilitate interdisciplinary cooperation to do One Health related projects, and this will help us also to learn the lessons of what are the limitations and the bottlenecks in letting these entities to work together, and then use that information to further refine. And therefore, it is not just a collection of few projects, but the projects all come together to build a program. And that, I think, would be one key aspect to have investments, but a sustainability in mind. I'll stop there and pass it back to Professor Rao.
Thank you very much. That was good message to carry on. I think you really covered many aspects. I'll go to Dr. Sorry, I just said about papers. Yeah. So, Professor Vanda, you have been with the viral diseases. Many times people list, they only list a lot of bacterial diseases. I don't find many of them listing viral diseases. And secondly, what is next in your experience has been the interaction of veterinary medicine people with the human medicine. Can you please answer these two questions? And what has to be done? Professor Vanda?
Dr. Rao, I think she's left.
Oh, she has left. Okay. I think we'll move on to the last. One of the best points in this particular session is we added social and behavioral aspects. I think although we had a very little time to spend, we have a couple of minutes here. I will ask Dr. Mayo, and what else we can add, how to carry on this agenda of social behavioral aspects. When you see the COVID, these are the very basic social and behavioral aspects, which is coming in the way of stopping the transmission of COVID. And it is also so, as you see many examples with the veterinary diseases. And of course, a lot of education awareness is needed. What are the actions on ground we have to carry on a large scale? Are these actions scalable? Dr. Mayo. Dr. Mayo? Hello? Yes, please.
Yes, sorry, I was unmuting. Thank you so much.
Fine. Yeah.
Thank you so much. I think I want to start by reflecting on some of the issues that came up from our team, where everyone said, okay, I think we realize that we need to bring the people in this whole discussion and action. But the whole thing starts at lack of collaboration between the technologies, the policy, and the social scientists. So this is one point that we would like to bring forward, that need for collaboration. Let's bring the social scientists' views in all the planning, in the prioritization, in raising awareness, in implementing some of these biosecurity approaches at different levels. But one issue also that came up in our session was really understanding what are some of the incentives that are needed to support the farmers in implementing these biosecurity measures, especially at farm level. So understanding these trade incentives and the trade-offs that are needed in this process is also important. We also need to understand the context, because context is key, and realizing that not one size fits all. I think one of our panelists underlined that. So even when we are sharing information or raising awareness on communicating, it's important to understand what context we are operating in. So context is key, and not one size fits all. And then for the different levels where the people are at household level, there are also issues that affect community level and also the national level. So those policies that we bring at national level, how do they affect the people? So understanding those different levels and also realizing that we need to involve the people in making some of these decisions and communicating in a way. So communication remains key in our interventions and in our approaches. So I would like to underline the collaboration with social scientists and also really being context specific and communication. So I'll put those three. Thank you.
Thank you very much. I think the message is very clear. And do you want to add any more to this message, Dr. Nicoline? Dr. Nicoline is around? Yes, please.
I'm still here, thanks.
Yes.
No, I think Bonnie said
Is
it
there
very
any
well.
economic angle to this? Yeah.
Well, like I mentioned, I think Dr. Moyo said it very well. And I would like to highlight is the real also understanding. So understanding why people are doing what they're doing. We usually don't like it. We might not even agree with it, but there's a reason people do things. And only once we understand that can we actually work with that to change the behavior. And we notice that that's very important. Telling them what to do will not work unless we understand them. So that would be my one message as well as we move forward on this.
Thanks. Great. I think we had enjoyed your session, Dr. Mayo. I think it was a new addition for us. We struggled to put them all together. Thank you for your help. Finally, I'll go to Dr. Karim Radia. Sir, you have been doing capacity building programs almost, I know, for about 15 years in Africa. A lot of people have stressed about capacity building at the laboratory level, at the human resource level, skill level, communication level, and all sorts of vaccine production. So many issues, diagnostics. What is new way of doing it now? It can be more effective based on your experience. Because these workshops, seminars are fine. Are there any solid actions that will make capacity building more effective?
Sure, yeah. Thank you, Dr. Rao. I think the last 2 years of this pandemic, of course, we have lost millions of lives, but I think there are some positive things that have come out, and it's really impressive because we were doing a lot of our programs in person here, people coming from all over the world to Michigan, or we taking groups to India or other countries. I think during the pandemic, we have converted a lot of these programs online virtually. And I think the emerging tools of ICT, the information communication technologies, these powerful tools have really given us new ways of doing things, So I think as we are moving forward, as we are looking forward, Michigan State and many other universities, I think we are looking at hybrid ways of delivering programs, So a lot of things will happen. There are some things, of course, we need to do it in person, but there are many things which can be done through online means without traveling thousands of miles, So I think that's one of the big area. Also, I think the technologies are allowing to store large amount of data at a very cost-effective way, and we can, gather that and have global access to that, So I think that's one thing that we are looking at. Looking at this 2 days of program, Dr. Rao and Dr. K and others, what I would like to suggest is we hope that a publication will come out from these 2 days of deliberations. I wish everybody could write a summary or something, and you bring out a proceeding or with some key recommendations and share it widely. Because I saw we had about 100 or so participants in the last 2 days, but world is bigger than 100 people, So how can we share that? So my request is that we bring out some kind of a publication with key recommendations and so on. And second thing, as I said, we are offering an annual course now online on zoonotic diseases. I would like to request that APAR develop a calendar of events. What's planned for this year in 2022? What activities are coming up? And so on. So I really liked in the chat, somebody said, communication, collaboration, coordination, and so on. So if you can develop some kind of action plan, and a calendar of event. And please develop both short-term and long-term. What do we plan to achieve as a network in the next 1 year, and then maybe next 5 year or 10 year, with some goals or some milestones marked. And each year we review that. And then lastly, of course, everything requires funding, right? So is APAR planning to develop some kind of a proposal or some kind of funding mechanism? I know Dr. K is at the Rockefeller Foundation at the Pandemic Prevention Institute. Can we all work together, APAR network members, and develop a proposal for a long-term funding or something mechanism where not just one donor, but multiple donors could come forward and so on. So I would like to hear from you, what are the sort of the plans for the future? But I think we at Michigan State, we are looking at the world very differently now. We are making our classrooms global. Yeah, we see lots of opportunities. So thank you.
Yeah, I think before we go to the concluding session, I think we're slightly delayed, but I will not resist from asking Dr. Kai. One of the things which we have been discussing is about what you call technologies in surveillance, emerging technologies application. And none of them have usually touched it, particularly use of big data, sequencing platforms, and integrating them towards surveillance. Can you just make some few remarks and move on to the concluding session? Dr. Kai.
Yes, indeed. So that's kind of interesting that you bring it up, because it was part of my closing remarks that I was going to make, and that we really need to start thinking about how we leverage these new technologies, especially big data analytics, and look at models from other areas. So financial industry, where where we have a globally connected network of data holders that depend on each other, but they cannot share data because it's, of course, a financial risk. So what happens is that those systems are developed in a way that data is held by their owners, and it's a federated system. So people don't give out their data, but they're part of a training, AI, machine learning training, big data analytical platform that can actually create models that inform developments in the overarching system. And so we should be thinking very closely and carefully about how we leverage this innovation type. I know that the Berlin Hub is very closely looking at these types of models, where we also look at leveraging queuing data, what we call alternative data, to indicate whether there's an emerging event. So how might we use the correlation of migration data, deforestation data, urbanization, climate change, social media queuing, and all these different disparate data sets to inform about that something is happening? And can that be combined with reference historical disease surveillance data and prevalence data with real-time surveillance in the field and outbreak data, so that it actually informs the system? This is far from demonstrated, viable, implemented, but there's certainly opportunity to explore how we might actually go there. And we at the Pandemic Prevention Institute are very closely monitoring this, especially with the advent of the genomic surveillance capacities that have been developed and implemented as part of this outbreak response globally, whether that is the Genomics Initiative in Africa, the networks we've been funding in Africa and in India, and capacities we've been building with the Pan American Health Organization, where that genomics data really informed about outbreak response and also variance discovery. And what is really exciting about this, that this global genomics effort has been channeled into data sharing with GIS-8. I don't know the numbers right now off my head, but it's exploded in terms of how many data samples and sequencing samples were shared with GIS-8, and that enabled actually scientists globally to collaborate in conducting research. So these are the types of models we really need to take a look at in terms of moving, especially the data sharing, the collaboration, the joint analysis forward. I hope that covered what you were looking for.
I think we have 9 panelists, and all of them contributed very wisely on the question, what are the lessons learned, how to go about, and what are the actions. Definitely we'll consider all these points while making the summary of the presentation, and also making whatever our requests are. Probably we'll explore to put all this in the form of a document, as Dr. Karim was suggesting. Sir will also take your help in this as a partner to us. And I'll close this session here without any expansion of individual messages. That is how I usually do. I don't nullify others' comments by being an anchor. So it will be floating in the air for you to think about who said what in this panel. I'll stop there